Painful, scared, and with limbs that weigh up to 16 kgs, these people had no hope left. With no cure available for most of these lymphatic diseases, all they could do was hope and pray. Thanks to a small not for profit charitable organization called the Institute of Applied Dermatology or IAD at Kasargod of Kerala province in South India, a new low cost self help treatment is here. Started in 1999 by a group of dedicated medical practitioners who believed that an integrated medical approach combining Ayurveda, yoga, and biomedicine can control many chronic diseases such as lymphedema that modern medicine alone could not do. Using this theory, a team of doctors, spearheaded by Dr. Narahari and mentored by Professor Terence Ryan, Emeritus Professor of Dermatology, Oxford University, came up with an effective home-based self-help, patient-centric and low-cost treatment for filariasis after strenuous research and numerous clinical studies. Called local immune deficiency syndrome or local AIDS by Professor Peter Mortimer of St. George's Hospital, London, lymphatic filariasis or elephantiasis is slowly spreading across the globe, affecting more than 120 million people, mostly in Africa, the Indian subcontinent and South Asia Pacific. In India alone, over 25 million people are affected in 15 provinces. Transmitted to other humans by the bite of the mosquitoes, the disease causes severe inflammation and swelling of the limbs, scarring and extreme disability. Until now, with no permanent cure in sight, the future looked bleak. IAD has now developed a self-care treatment for mobility control of lymphatic filariasis, which is not only simple and painless, but can also be done at home after a brief training period. An integrated or shotgun method of combining Ayurveda, allopathy and yoga is used. Patients are admitted to hospital with members of family or their community for treatment for 14 days, where they are also taught how to continue the treatment at home. Baseline volume assessment of lymph is performed using water displacement and girth measurements. The treatment, which lasts for about 1.5 hours, starts by washing the patient's affected area with soap and water, taking care to wash among the skin folds of the larger limbs. The lymph is then soaked in an Ayurvedic skincare solution called Fanta. After carefully drying the lymph, skincare creams are applied to take care of infection entry points. This is then followed by yoga exercises. An instructor first coaches the patient on correct posture and breathing techniques. Yoga in our treatment protocol promotes lymph flow and replaces central lymph drainage practiced by Foley's method. Immediately afterwards, the patients are given an Ayurvedic skincare massage called Indian Manual Lymph Drainage or IMLD. This is given in two parts. The first called Unmardhana without oil and second Udvarthana where oil is massaged into the skin. Herbal oils are selected on the basis of patient's physical constitution or prakriti. The swollen lymph is then wrapped in a long stretch compression bandage as done in Foley's method. Once again, the patient performs a set of yoga exercises called post-IMLD yoga. Patients who have organized lymph are given another traditional Ayurvedic treatment called Ekanga Svedana, where steam from medicinal herbal water is sprayed on the affected lymph for about 20 minutes. The patients are discharged from initial 2 weeks of supervised treatment are advised to continue as family member assisted self-care for 6 months, together with taking 2 oral Ayurvedic medicines for skin care and lymphedema and following a strict vegetarian diet. With patients now seeing significant reduction of swelling in the affected limbs, they are able to resume normal activities. Supported by a small research grant from Kerala Provincial Science and Technology Council, Indian government's funding agencies like Department of Science and Technology, Indian Council for Medical Research and Department of Ayush, IAD has managed to do all this and more, thanks to its beneficiaries and collaborators. Collaborating with International Lymphedema Framework London, International Cochrane Skin Centre Nottingham, and Indian Institute of Sciences Bangalore, IAD has conducted more clinical studies achieving scientific publications. The replicability of this protocol at the community level is successfully observed in more than 700 households spread across 12 provinces. What is being shown here is visually and neurologically challenged lymphedema patients are able to perform the self-help treatment with minimal support from the family after a brief training. IAD has helped over 1100 lymphedema patients so far. Now the ground is broken by Professor Terence for its new 30-bed hospital in Kasaragod, partially supported by government subsidies, with underprivileged patients receiving free treatment and the cost for the others being as low as 20,000 Indian rupees or approximately 400 US dollars. IAD has created a facility that is accessible to those who need it the most.